Hi there, this is one more video of our special project called Good Samaritan, and this time we went to Udupi, which is southwest of Bangalore, about 400 kilometers, maybe around 300 plus miles, and we visited CSI Lombard Memorial Hospital on the 3rd and 4th of August, and we had fixed an appointment with Dr Sushil Jathanna there earlier, and we had time with him on the 3rd and also on the 4th. This hospital was founded by a Swiss pioneer medical missionary in the early 19th century, and she started this with 6 beds, bunk beds, but now it has over 200 beds, and it is serving the community. And this place wasn't very easy to work with, so she had opposition, but over the time people saw her sacrificial work and she worked there. And this hospital last year, 2020, in the wake of COVID-19, in the month of March, they started COVID center to treat COVID patients. So they have treated about 100 patients. Few died, and out of this, most of them were recovered. Out of this, 3 of them were elderly, between 90 plus and 100 years old. They were recovered and gone back home. So this is a wonderful journey, and this video will take you through. Paul will help us to understand the various things there, and he will explain.
So we're here today at CSI Hospital, Lombard Memorial Hospital here in Udupi. So as part of Project Good Samaritan, we've come here to see their COVID care, and also as we are supporting the COVID operation here. So we're going to be talking to Dr Sushil Jathanna, as well as going to the chapel for a little bit of prayer with the reverend over here, and also just seeing how everything works. Because the thing is, not many people know this. There's been a lot higher number of cases in Mangalore and Udupi. It's about 5.2 to 5.8%, which is higher than the average of the entire state, which is about 2.8. So what's happening here in the hospital is, what they've decided is to redo the entire piping of the oxygen supply. They want to future-proof it. That is what their plan is. The plan is to do this better. Listen, we're not going to get rid of COVID anytime soon, but what we can do is, by future-proofing for the next generation, by having an entire oxygen supply to all the wards, be it to the childcare department here, be it to the casualty department here. The plan is to have oxygen piping all the way around. It's good to be here. I would like to thank Rachel Iyer and also Dr. Sushil Jathanna for giving this opportunity. And also I'd like to thank CSI Lombard Hospital for enabling us to be a part of your COVID care. So Good Samaritan project started out after what happened on May 2nd in Chamarajnagar, when 24 people, now they're saying about 35 people died in less than 4 hours when there was no shortage of oxygen supply. We've been praying. Since the first wave, we got into providing food kits to various parts of Karnataka as well as in Chhattisgarh and in Assam. When the second wave hit, we were like, what do? We've been praying that Corona should go. But Corona is here to stay. There's no way around it. So we're like, what can we do more? And that's where Good Samaritan project came about. When we saw the need of the hour was to provide oxygen cylinders, we asked for help. We actually stuck our hand out, we asked for help. And there's one thing that we don't do. We as Indians, we think that we can do everything by ourselves. We don't need to ask for help, but we asked for help. Because there's so much we can do by ourselves, so we asked for help. And we had people who supported us. We had people who were able to contribute towards providing for this Good Samaritan project. And this was, we prayed, God, if you provide for this, will we get into this? Because oxygen cylinders, everything, black market, everything went up. The government wasn't here to help. There are so many things. And it was, how do we do it in such a way that we are being stewards of God's money as well as we are accountable and helping people? The main thing about TTI has been for so many years about care and compassion. It's something that's there even with hospitals, providing care and compassion to those who aren't able to afford it and also those who have been neglected by the society. That's one of the reasons it's called Project Good Samaritan. Because if you read in Luke chapter 10, it was someone who was at the wayside, who no one looked, but someone came and helped him. And that message will be spoken. So we started that, and we wanted to first help the hospital in Chamrajnagar, the government hospital. We asked them, is there anything? And and it was very sketchy. They were like, you have to do this, do this, do this. Then they were like, no, we don't want it. So then we were like, what else can we do? And one of the things was Mission Hospital. Mission Hospital has given back to the community so much. And it's the time to equip them in this next phase. Because COVID is here to stay. We spoke to Dr Sushil yesterday, and he was like, COVID's not going to go. But what can we do best is like mission hospitals are disappearing. And one thing about mission hospitals and even the church community was, the church was at the center. When you have God, Christ at the center, everything flourishes. If you look at the mission hospital right now, it's placed at the center here and everything's around it. It's the same thing as the church. The church is at the center. The church is like a lighthouse. So we need to equip the churches. We need to equip the hospitals in this fight towards COVID. So we've already done, last month on July 20th, we were in Kodega, in Chikbadapur. We helped the hospital over there, the CSI hospital over there. And here we've come to give a small gift towards your bigger project of doing the oxygen generator, the entire thing, that project that you have. We're trying to do something little. But more than us, it's all of you who've done it. You are the real heroes who are putting yourself in line towards this. Yes, we might have come from Bangalore, but that's nothing compared to what you guys are doing. You guys are the true Good Samaritans over here. You guys are the true warriors. You guys are the heroes. And we would like to say from Tribal Transformation India, thank you for giving us an opportunity to be here in your presence, to witness what you guys are doing, because you are doing an amazing work. Thank you. Doctor, could you just tell us a little bit about yourself, like your history and about your family and how that all culminated with you coming back to India and to this hospital?
Yeah. Okay. I actually did my MBBS from KMC Mangalore, Manipal Mangalore. And immediately after I finished my medicine, I went to UK for higher studies. And when in UK, I was trained basically as a general physician in medicine, but I also then developed qualifications or got qualifications in community medicine or public health medicine as it's called in UK, and also I did a master's in health policy and also did postgraduate qualifications in management. So initially I was a director of public health I was a consultant first, then a director of public health, and then I became managing director of one of the largest healthcare companies in UK. And after that, I ended up being the chief executive of the National Health Service in Cambridge. So before I came to Udupi or Mangalore, which is my hometown, I was chief executive of the National Health Service in the whole of Cambridge. And my only aim is to try and develop the mission hospitals and our institutions, which when you see across the country, our educational institutions and hospitals are going down. Large number of mission hospitals are being closed, and therefore it is the onus is on us to try and ensure that all these hospitals and educational institutions, which was predominantly started or established by missionaries giving their blood, sweat and tears, we as Indians should build on those foundations and not destroy the buildings and services they have built. So that is my main aim.
Doctor, that sounds great. So one of the things about the history of this hospital, in another year it's going to be about the centenary.
That's correct.
It was started by Dr Eva Lombard, a Swiss medical missionary who had come to India, and it has grown. How has it grown from then, doctor? Because you said you've come and you've made some changes to the hospital, because this was known mostly for child care and for
maternity.
And for paternity. How has it grown since then, and since you've come back? I think since 2016 there have been a lot of changes that have happened to the hospital, right?
Absolutely. Dr Eva Lombard was a Swiss missionary, as you said, and she was very young. I think she was around 28 years when she came to Udupi, which was a very conservative town in those days, and people in labor couldn't be attended by male doctors. So a lot of children couldn't be born because of lack of maternity care. So Dr Eva Lombard started the first 6-bedded maternity unit. So that's how Lombard Memorial, at that time it was called Mission Hospital, was born. And since then, after she retired and went, the name was renamed as Lombard Memorial in memory of Dr Lombard, who did some human service here in Udupi. So if you look at the 3 arms of the ministry as such, which I conclude as preaching, teaching and healing.
Yes.
We are doing both teaching and healing in this, and of course we haven't forgotten the preaching. You have visited the chapel this morning.
Yes, Doctor.
And every morning our work starts with the chapel at 8 o'clock. So we haven't forgotten the preaching part as well, and therefore we aim to develop and deliver holistic care to all our patients.
Doctor, that's wonderful to hear. You touched on a point of care and compassion, and that was the message today morning also, and one of the reasons behind Project Good Samaritan, about compassion, about caring, about sharing. And can you let us know a little bit more about how the COVID care has been happening? Because as we spoke earlier, you had mentioned that the rates in Udupi and in Mangalore are quite higher. It's like double than most parts of Karnataka. Like, how is it affected or impacted the hospital going forward with COVID care?
Yeah, we've had 2 experiences now, the first wave and the second wave. The first wave, like most of the hospitals and healthcare establishments, we were not prepared for it. In the second wave, we were actually prepared for it because, for example, give you a good example, in the first wave, we didn't have a COVID ICU, but in the second wave, we ensured that we had a COVID ICU because ventilators were at a premium. And oxygen supply was also very difficult to access. So we had an ICU for COVID patients, but we also did not forget the non-COVID patients, because there is a danger when COVID sweeps you that the focus is on COVID patients and the non-COVID patients get ignored or neglected. So we had a non-COVID ICU separate from the COVID ward as such. But in terms of admissions, we had a triaging area, we had a testing area, we had a suspect COVID ward, and we had a COVID ward. And of course, as you know, in the COVID ward, people had to wear the PPEs, etc., in terms of looking after the patient. So we had both a COVID ward, separate COVID ward, and a separate suspect COVID ward as well.
Doctor, now with the COVID ward and how you've gone forward, and for enabling us to be a part of your long-term plan, because I know that you're trying to move away from reliance on oxygen cylinders and you want to go more of having an entire pipeline. And I know your project is a grand project. It requires a lot of funding. And for Project Good Samaritan, for Tribal Transformation India, and even the small gift that we're giving, how will that be used going forward, Doctor?
I always believe in a very simple principle. Do not let any challenge go to waste. And therefore, this has been a great challenge. Dealing with COVID has been a great challenge. But it also has been an opportunity for us to try and ensure that we upgrade our facilities to meet all eventual needs. And therefore, one of the things that we learned in the first wave and in the early parts of the second wave was the lack of oxygen. And what we have therefore done is now been able, through the well wishes of a generous donor, to get an oxygen plant, which will be arriving hopefully in the next 3 to 4 weeks. And therefore, to support the oxygen plant, we needed to ensure there's oxygen pipes in the rooms, the ICUs, the casualties, the labor theatre, the operation theatres, etc. And your contribution today will be going towards laying the pipe work or the pipeline for oxygen supply to all the wards, and also the creation of what is known as a high dependency unit. So that's where your contribution today will be going, in addition to some other people's contributions as well. So the purpose is to ensure that in future we will not be in need of oxygen. You will hopefully not see the pictures on your TV screens that you saw during the second wave. I hope everyone follows this and is prepared for the third wave. And this is part of our preparedness for a potential third wave if it comes.
What can be done, like public awareness and even for the welfare, not just the patients, but how is the welfare of the nurses and the staff being taken care of, doctor?
I think this is a huge challenge. Lots of our own staff, nurses, doctors, etc. went off sick due to COVID. But one thing I'm very proud, that they all came back and worked again despite having suffered from COVID infection. They are truly the COVID warriors, honestly. And hats off to them, and I'm grateful to them, and may God's blessings be on all of them to continue to serve in the future as well. In terms of preparation again, we still need, whilst we know God will protect us and this hospital has God's blessings, we still need to do our part as well. And what we have done is made sure that all of our staff are vaccinated this time. Now that will not be a guarantee against not getting infection, but what it will do is protect them from severe illnesses and fatalities. And therefore at this time, I think there are just about a handful of staff nurse, but all the students and the staff have at least got one dose of vaccine, and most of them have got the second dose as well.
Dr. Jathanna, from us at TTI and also the friends of TTI who are able to do this, thank you so much for allowing us to be a part of what you're doing, and for being a part of Project Good Samaritan, because for us it was more to do with how can we help, and one thing was with mission hospitals, how could we do something. And what you're doing here, you're looking not just currently, but you're also looking well ahead into the future. We wish you all the best, and it's been a pleasure just seeing each and every single thing that has been done to the facilities over here to improve it and to better life, because I think that's something that is clear from what you're saying. We need care and compassion towards every walk of the society and not just a certain few, but to look at everyone as. And
because let's not forget, mission hospitals are not just taking part in the healing ministry, they're not just taking part in treatment and care of patients. We are here together building the kingdom of God, and that is important for us.
And may the Lord continue to guide us what we want to do in future. But all these hospitals, the one speciality what I've seen was, in spite of their healing ministry, they have a team of people, those who do evangelistic work with the patients. They do follow-up work and also the outreach, they call it. Thank you for helping us to make this trip, this project working in this place. Thank you very much.